Hi, and welcome to this podcast, the IELTS, OET, and UK MLA PLAB 2 Made Easy podcast for medical professionals. My name is Kalsoom, and I specialize in training doctors and nurses to get the score they need in IELTS and OET, and also training doctors on how to improve their clinical communication skills for UK MLA PLAB 2. The aim of this podcast is to arm you with authentic advice from someone who has been teaching these tests, especially IELTS and OET, for over 10 years. I share the core fundamentals of these tests, the essential information, strategies, and advice on what you should be doing and what you need to avoid doing. Anything and everything to make sure you keep moving forward in your preparation and getting you closer to achieving your scores and getting your dream job abroad. I understand and appreciate that your time is busy as medical professionals. You have very limited time, so I do try to keep the episodes short. And one of the advantages of podcasts is that you can listen on the go. So before I get into the main topic of this episode, there are a few things that I'd like to bring to your attention that you can find in the show notes. So you'll find lots of links in the show notes. And firstly, you'll find the link to my free training for OET called OET Success Training, which is a series of 5 videos that take you through all aspects of the test. And I share how you should be preparing and how you can improve your skills. And this training alone has helped so many doctors and nurses get the score they need. If you would like to train with me for OET, then you'll find the link to my flagship OET Success membership group and also a little video which explains how the training works. You'll also find a link to my free PLAB 2 Core Clinical Communication Skills webinar. This is a webinar I delivered earlier last year, where I go through the key clinical communication concepts that need to be present in any consultation. It's an invaluable resource to help you not just for your PLAB 2, but beyond the test and in your careers. If you would like to join my clinical communication mastery for UKMLA PLAB 2, then just drop me an email. This is a group training program of only 8 doctors. So I only take 8 doctors at a time, only 8 doctors in one group. This is to make sure that everybody in the group gets enough practice and feedback. So if you're interested in joining that, then just drop me an email, which leads me to the last thing. You can find my email address and how you can contact me and connect with me on LinkedIn. Hi, and welcome to this episode. So in this episode, I'm going to talk to you about the mindset shift you need before walking into the OET speaking room. And I feel quite strongly about this because I've seen how effective this can be for some students. And it is a problem that quite a lot of students have. And if you follow these simple steps, it can change your whole OET speaking experience and maybe even your entire approach to communication in English. So what is the mindset shift you need before walking into the OET speaking room? And why is it important? It's important because it can sometimes, what can sometimes get in the way of most candidates isn't the lack of grammar. It isn't poor vocabulary. It's how they see the exam, how they see themselves. So if you've ever walked into that room, the OET speaking room, with shaky hands, a racing heart, and a voice that doesn't sound like your own, then listen on. So let's be honest. If I gave you a speaking role play card right now, one-to-one, in a relaxed environment, you'd probably do quite well. You'll probably score quite highly. But when it's test day, something changes. Well, why is that? It's to do with your internal dialogue. You start thinking, what if I make a mistake? What if I forget the right phrase? I need to sound perfect. I must impress the examiner. But here's the reality of it. Here's the truth. When your brain is in performance mode or in test mode, as I like to call it hijacks your fluency. It blocks the natural language you already know how to use. You let the fact that you're in a test situation override everything you know. And that anxiety shows up in your language. It shows up in the form of short answers. It shows up in the form of your flat tone, your lack of confidence, your disconnection from the patient. It's you trying to overcomplicate your language and responses. You end up missing bullet points from your role play card. You end up not explaining things correctly, talking too much and not allowing the patient to speak enough, making it a very doctor-centered consultation. It You end up with bad sentence structure and poor vocabulary choices. But none of this is because you have a language problem. You know your stuff, you know how to speak, you know how to communicate. The problem is your mindset. It's a mindset problem. So there has to be a shift in your mindset before you start the test. And what you need to remember is, and this is very, very important, you have to remember before going into that test room that you are already a professional. You've spoken to real patients. You have worked in real clinics under real pressure. You've shown empathy. You've explained treatments. You've handled confusion. You've handled aggressive patients or non-compliant patients. You know how to convince a difficult patient. OET speaking is not asking you to be anything else. It's asking you to be exactly who you already are, a clear communicator, a calm professional, a safe pair of hands. So here's the shift. You have to stop thinking, how do I impress the examiner? And you need to start thinking, how can I help this patient? You have to start thinking, this isn't a test room, it's a consultation room. The examiner isn't your judge, they're your patient, someone who needs your help. And when you focus on connection over perfection, your communication improves instantly. So I know you're probably thinking, well, that's easy to say, but once you get into the test room, your nerves and everything, this is something that you need to work on before you get in the test room. You really have to train your brain to think more tactically and more strategically. So here are some mindset shifts that I teach my students. And I have been teaching this for many, many years, and I have proven results that it really does work. Students have come back to me and said, look, if you hadn't have told me these things before the test, and if I hadn't kind of practiced this before the test, I wouldn't have passed because nerves have got the better of them before and they failed the test. So do give this a try. So before the test, you need to have a shift of your identity. You need to tell yourself, like really tell yourself, talk to yourself and say, I'm not a student. I'm a working healthcare professional. I'm a doctor or a nurse, and I help patients every day. And this is just another one of those days. You're not being examined. You're just being observed, doing something that you're already good at. And I'm sure in your working life, you have been observed by your seniors, and just think of it as something similar. Focus on the human connection. So during the role play, shift your focus from your own nerves to the other person's needs. And ask yourself, what is this patient really worried about? How can I make them feel understood? What words will reassure them right now? So this takes you out of your own head. It takes you out of your own thoughts and into the real task, which is providing care. So essentially, you're immersing yourself in your role and in the role play. Another thing you can practice is practice imperfectly. So many candidates, they rehearse only when everything is right, when they have a quiet room, they have their notes in front of them, they're practicing with a favorite speaking partner. But life isn't like that, and neither is the exam. So you need to mix it up a bit and try different scenarios, different situations. So practice when you're tired, for example. Use noisy environments. Switch partners. Find somebody else to practice with. And role play unfamiliar scenarios and situations, ones that you haven't done again and again and again. And in this way, you're training your brain to stay calm under any conditions, and that's quite powerful. Another thing you need to remember is, and this is very, very important as well, that you don't need to have perfect English to pass OET. You need to acknowledge that you will make some mistakes, and that's okay. You can still get the grades you need and still have mistakes. OET are not looking for perfect English. They're looking for good communication skills. So your presence, your empathy, and the control of what you do and how you control the situation and help your patient. So, for example, if you forget a word, that's okay. Paraphrase it. If you're feeling nervous, that's okay. Take a breath. If you make a grammar mistake, fix it and just keep on going. This is real communication. It's not a grammar quiz. Focus on the communication and being clear. And what is OET really asking? It's asking, can you show up for your patient clearly, calmly, and kindly? If you can do that, your score will reflect it. So just as a quick recap, before you walk into the test room, you need to anchor yourself with these three beliefs. And I believe even before you're walking into the test room, this work needs to be done in your mind. You need to train your brain to do this. You need to tell yourself, I'm a professional and this isn't a test. I'm going into a professional situation. I'm here to help the patient, not to impress the examiner. I will focus on clear, calm communication, not perfect English. Maybe you want to repeat this again and again to yourself, write it on sticky notes and, stick it around everywhere where you practice, where you do all your work and, keep repeating it on your own and really kind of absorb that into your mind because that mindset will carry you through nerves. It will carry you through tricky scenarios, unfamiliar accents, and help you shine no matter what the scenario is. So if this episode has resonated with you, if you're somebody that's struggling with confidence, with the pressure of the test, the nerves in OET speaking, I want to know if this has helped you. There is a comment button in the show notes now where you can send me a direct comment. So I'd love to hear from you. And if you're looking for real personalized feedback or guided speaking practice where we build not just your language, but your mindset and your confidence, you have my contact details in the show notes as well. So until the next episode, take care and keep working hard. I really hope you found this episode helpful. I always enjoy getting your feedback, so do drop me an email and let me know your thoughts. Also, if there is any aspect of OET, IELTS, or PLAB 2 that you find challenging, then let me know and I'll do an episode on it. In the meantime, thank you for listening and make sure you share this podcast with your colleagues and on social media so more people can benefit. And some parting advice, especially to those who have failed. failed to get the scores that they've needed in the past and are retaking any of these tests. It's not enough to just listen to what you need to do to improve your skills and scores. You must implement the advice and practice. You have to push yourself outside of your comfort zone because that's where real progress is made. Remember, nothing changes if nothing changes. Take care and keep working hard.